Hello, my name is Dr. Miriam Anand. I'm an allergist immunologist and I treat conditions such as allergies, asthma, food allergies, eczema, and other allergic conditions. I did my training in internal medicine at the Mayo Clinic in Scottsdale, Arizona, and then did 2 years of training specifically in allergy immunology at National Jewish Medical and Research Center in Denver. So many people often ask why they suddenly get allergies after moving to Arizona, or they say that they never had allergies before and now they do. There can be different reasons for this. First of all, we do have to be genetically predisposed to get allergies, so not everybody will get allergies. But unfortunately in Arizona, we have our beautiful weather, which allows a lot of things to grow and release pollen into the air much better than they could in other parts of the country. Actually, in Arizona, there are very few plants that were native to the desert that caused allergies. And so a lot of people in the 1930s and 40s moved here because of their allergies and asthma. Unfortunately, they also brought their grasses and their trees with them. And this is one of the reasons why people who move here now feel like they do a lot worse. When we talk about treating allergies, we generally talk about three things. The first is avoiding what you can, the second is medications, and the third is allergen immunotherapy or allergy injections. So the first thing in treating allergies is making sure that you're avoiding what you are allergic to. But unfortunately, sometimes that can be pretty difficult. For example, pollens are produced by grasses, weeds, and trees, and they are released into the air outdoors at certain times of year. So to a certain extent, you can't completely avoid them. We do ask as much as possible that you try to limit your outdoor exposure, especially during the bad times of year, and try to stay inside with the windows and doors closed and the air conditioning on. In the car, you would want the windows rolled up and the air conditioning on. If the car lets you choose between fresh air or recycled air, choose the recycled air. If there's any gardening or yard work to be done, ideally you're not doing that. If you have to do it or you really enjoy gardening, then you're going to want to make sure you've taken medicines first and that you wear a mask when you're doing it. After you come back inside from being outdoors, whether it be doing yard work or if you've been out at the park or a barbecue, you immediately want to change your clothes and throw your clothes right into the hamper or the washing machine. That way you won't carry the pollen around the house with you. And ideally anybody else in the house would also do the same thing so they aren't carrying it around on their clothes. If you use nasal washes, you can use those to rinse the pollen and dust out of your nose. And you may even want to take a shower and wash your hair before you go to bed, especially if you have long hair, so that you're not breathing in pollen that way. Molds can be found inside and outside. Outside, they can get blown around on windy days, just like pollens can. So particularly on windy days, try to limit your outdoor exposure. Outdoors, molds are found in the soil and on dried leaves. So if there's any digging or raking to be done, ideally you're not the one doing that. If you have to do it, then make sure you've taken your medicines and wear a mask when you're doing it. Indoors, molds can be found in a variety of places. So sometimes the mold spores can settle like dust settles. So if you have old books and papers, we ask you to keep those to a minimum. Houseplants are another place where molds can grow, so we ask you to keep those to a minimum also. Using a swamp cooler or humidifier can increase the amount of molds in the home, so also we advise that you don't use those. Any place where there's a source of water is a place where mold can grow. So if you have any leaks, they need to be repaired. If the area that got wet involved drywall or carpeting and it was wet for more than a day or so, then you need to have that removed and replaced. If the area that got wet involved tile or another hard surface, then you can clean this with a combination of bleach and water and allow that to thoroughly dry. Needless to say, the leak also needs to be repaired. One thing that can be very helpful for patients is having a HEPA filter in the home, especially in the bedroom. A HEPA filter is a freestanding machine that can clean the air of dust, pollen, mold, and animal dander. It is different from an ionic filter. Ionic filters don't work as well, and they also release ozone, which can actually be more irritating for people. So we definitely recommend a HEPA filter. Pets, such as cats and dogs, can not only have their pet dander on them, but can also get dust, mold, and pollen on their coat. For this reason, we recommend that people with allergies not have any pets in the home, even if they're not allergic to the pet themselves. Unfortunately, there is no such thing as a hypoallergenic pet. What we're allergic to comes from the saliva and the urine, and since most pets make those, there's no such thing as a hypoallergenic pet. If you do have pets, we recommend trying to have them as outdoor-only pets. Unfortunately, this may not be possible due to age, breed, weather, and other conditions. We therefore recommend trying to keep them isolated to tiled areas of the house only. But the very bare minimum is making sure that your bedroom is completely off limits to the pets. Because even if they walk in during the day, sit down for a few minutes, and get up and walk out, they've left the pollen, dust, mold, and their animal dander behind for you to breathe in later. You also want to make sure that you are bathing your pet regularly. Ideally, this would be once a month, and in between baths, you would wipe down the pet with a wet rag. That won't get rid of everything, but it'll help reduce some of the things. Dust mites are, for lack of a better term, little critters that live in stuffed things, such as pillows, mattresses, stuffed furniture, and stuffed animals. The good news is, in Arizona, we don't think we have a big problem with dust mites because we don't have very high humidity levels. If you have a humidifier or a swamp cooler that you're using, however, they can be an issue. So again, we advise against using those. There are special dust mite protective sheets that one can buy that include pillowcases, mattress covers, and box spring covers. And you may consider getting those because they might be helpful with your other allergies as well. You'll be receiving quite a bit of written information from our office regarding other things you can do to avoid allergens. So please review those and implement what you can. The second component of treating allergies is the use of medications. There are different types of medicines, and your provider will determine which ones are right for you. So we use multiple methods to treat allergies. Medications can include things such as antihistamines, which include medications such as Zyrtec, Claritin, or Allegra, and they can help treat what I call the itchy, runny symptoms. So runny nose, drainage in the throat, itching in the throat, etc. We often also use nasal sprays that can help for nasal stuffiness and swelling in the nose, and those things can lead to sinus pain and pressure. So the nasal sprays can be very helpful for that. One thing that we often include with medications are nasal saline rinses. And this is rinsing the nose out with salt water. It's technically not a medicine, but that can be one of the most effective means of helping control your allergies and preventing sinus infections. The most important thing to remember with the medicines, however, is that they work better at preventing symptoms than they do at stopping them once they've started. For this reason, it's very important that you use your medicines every single day, at least during your seasons, but possibly throughout the year, because again, they will work better at preventing your symptoms rather than stopping them once they've started. Medicines do not change how allergic to anything we are, and there is no cure for allergies. The only thing that can help change how allergic to things we are is allergen immunotherapy. The most effective form of this are allergy injections. With allergy injections, we gradually build up your tolerance to the things that you're allergic to. We start out giving allergy injections once per week, and once patients have reached their highest doses, ultimately get to once per month. Now, most patients won't notice a big difference until they get to the higher doses, and depending on how long that takes, sometimes it could take up to a year. So we do ask that you stay on the allergy injections for at least a year before we decide that they aren't helpful. If they are helpful, then we'll recommend that you stay on them for at least 3 to 5 years, but it's not once a week that whole time. Once you're up at the highest doses, we try every 2 weeks, then every 3 weeks, and then once a month. The biggest side effect from the allergy injections is the risk of an allergic reaction. Most of the time, this is itching and swelling where we give you the injection, and we don't worry about that for the most part. We don't want to see a reaction that happens anyplace else though. So in other words, you get the injection in the arm, but now you feel like you're having worsening allergy symptoms or asthma symptoms, or you may be feeling itchy or getting hives. For this reason, we require patients to get the injections in a doctor's office, and they must wait 20 to 30 minutes after their injection to be sure that they're doing okay. But if they leave the office and then start to have symptoms, then they need to let us know right away, because in very rare situations, these are potentially life-threatening reactions. Your provider will let you know if allergy injections are something for you to consider. So allergy injections are the best method at helping reduce how allergic to things you are. They actually act to help build up your tolerance to the things that you are allergic to. Reasons to consider allergy injections would be if it's very difficult for you to avoid the things that you're allergic to, or if you feel like medicines are not helpful for you, or you feel like you have to take a lot of medicines to help treat your symptoms and you would like to do something to help reduce your allergies. We surveyed our patients here at Allergy Associates in Asthma, and we found that 92% of them that get allergy injections have found that their allergy injections are helpful. If you think you or a family member may be struggling with allergies, or you're wondering whether or not you have allergies, please come see us because we can definitely help. You can also find plenty of information on the internet by searching Allergy Relief AZ. We also have an app that you can download to your smartphone or tablet as well, and you can contact us directly through there. We also have an internet site, which is www.allergyasoc.net. That's allergyasoc.net. And you can call us at 480-838-4296.